Welcome to Module 4 in the Healthy Minds for Life Mental Health Education Series. Before we begin, we would like to thank Windsor-Essex Community Foundation 646 program and Green Shield Canada for their generous funding for this program. This section is entitled Worried Sick, Understanding Anxiety. Let's start by trying to better understand worry, which is essentially thinking about negative things that could happen and their consequences. This is our brain's way of dealing with anticipated negative outcomes. It can be thought of as mentally planning or preparing for the future. This can result in building elaborate scenarios in an effort to predict what could happen and how you might deal with various situations. So, when is worry a problem? We all tend to worry more during times of stress or major life changes. This is a normal reaction. A major trigger for worry is uncertainty. Worry can be considered problematic when experienced every day. It is excessive given the situation. It is difficult to control. It interferes with a person's daily life or leads to significant distress. It causes a reduction in quality of life. We must remember, most of the things you worry about never happen. Next, let's discuss anxiety. It is one of the most distressing emotions that people feel. The underlying emotion is fear. For example, the fight-flight response. At times, it is a response to a specific situation. However, often you cannot specify what exactly it is you are anxious about. Anxiety affects your whole being. Physiological, for example, a racing heart; behavioral, like the inability to speak; and psychological, like thinking you're not going to make it through this. Simply put, anxiety occurs when the danger of the situation outweighs the number of appropriate coping skills you have. This diagram showcases some of the many symptoms of anxiety, including sweating, shaking, numbness, and chronic fatigue, just to name a few. What is the difference between anxiety and worry? Worry are thoughts we all have, whereas anxiety is both the thoughts we have and our physical reaction to those thoughts. Anxiety can result in physical changes in the body. For example, the fight-flight response or the physical sensations you experience when you feel threatened or in danger. Anxiety becomes problematic when you experience it frequently and it impairs you in your daily life. This chart shows some of the differences between everyday anxiety and an anxiety disorder. One may experience worry about paying the bills, landing a job, or other important life events, and this would be classified as everyday anxiety. However, constant and unsubstantiated worry that interferes with daily life would be classified as a disorder. Another example would be feelings of sadness or difficulty sleeping immediately following a traumatic event. This moves into a category of a disorder when recurring nightmares, flashbacks, or emotional numbing take place and is related to an event that occurred several months ago or even years prior. Now let's discuss the difference between anxiety and stress. With stress, we know what's worrying us, but with anxiety, you become less aware of what you're anxious about, and the reaction becomes the problem. Anxiety comes from a place of fear, unease, and worry. It may also lead to frustration because of the thoughts and feelings that come with experiencing an internal struggle. However, anxiety can be useful. Everyone experiences anxiety. The fight-flight response has developed for a reason. It serves as a warning to modulate or cease a behavior that is dangerous or counterproductive. It serves as a warning to reevaluate the wisdom inherent in following one particular path relative to alternate ones. Anxiety can help us develop courage and help us through challenging situations and help us grow. Anxiety disorders involve excess fear and usually have negative emotional and behavioral consequences. The different types of anxiety disorders are social anxiety, anxiety and fear that occurs in response to social situations; generalized anxiety, excessive worry, free-floating anxiety with no particular trigger; phobias, unreasonable fears of objects, animals, or situations; panic, repeated intense episodes of sudden fear and physical symptoms; obsessive-compulsive, uncontrollable, repetitive, unwanted thoughts or actions; post-traumatic stress, a traumatic event causes intense fear, helplessness, or horror; How your day may look or feel if you are experiencing anxiety. Worry, tension, irritability, without cause, inability to relax, concentrate, or sleep, fatigue, trembling, muscle tension, headache, sweating, heart palpitations, affects quality of life or the ability to function at work or school, avoidance of people, places, and things, unhelpful coping mechanisms. Symptoms last 6 months or longer. They can develop slowly, change over time, or you may feel an increase in periods of stress. Here are some anxiety symptoms with regard to behavior, mood, or thoughts. Behaviors: avoiding situations where anxiety might occur, leaving situations when anxiety begins to occur, trying to do things perfectly, or trying to control events to prevent danger. Moods: nervous, panicky, or irritable. Thoughts: overestimation of danger, underestimation of your ability to cope, underestimation of help available, worries, and catastrophic thoughts. Are we struggling against the thoughts in our minds, our emotions, or sensations in our body, or are we open to noticing them and letting them be? Is our struggle switch on, or is it off? The mind not only produces thoughts and judgments about our emotions, but also stirs up questions and comments that make us feel worse. In order to effectively deal with uncomfortable emotions, we must accept the running commentary of thoughts as only words and not facts. The following brief video will explain further.
It often seems like we've got a struggle switch at the back of our mind, and as soon as an uncomfortable emotion, a painful feeling or memory shows up, it's like the struggle switch goes on and we start to struggle with it. So let's suppose anxiety shows up. A very common, painful emotion that we all get to experience. Anxiety shows up, the struggle switch goes on. Oh, here's anxiety. I don't like anxiety. I want to get rid of my anxiety. Now I've got anxiety about my anxiety. So it's getting bigger. With the struggle switch on, I now get, oh, my anxiety is getting bigger. How do I get rid of my anxiety? Now I've got even more anxiety. With the struggle switch on, I may then get angry about my anxiety. Why is this anxiety keep showing up? I hate this anxiety. Then I might even start to feel sad about my anger. Oh, is this my life? Oh, and then I may start to feel guilty about my sadness about my anger. Oh, how pathetic am I when there's starving kids in Africa? So with my struggle switch on, my emotions get amplified. I've now got guilt about my sadness, about my anger, about my anxiety, And that kind of amplification of emotions gives them more impact and influence over my life and often gets me bogged down or pulls me into self-defeating behaviors. Now, what happens if I can switch off the struggle switch? With the struggle switch off, anxiety shows up, and it's not that I like it or want it or approve of it, it's just I'm not going to struggle with it. I'm not going to invest my time, energy, and effort in struggling with this anxiety. Instead, I'm going to invest it in doing meaningful, life-enhancing activities, such as spending quality time with my friends and family or playing with my kids. Now, with the struggle switch off, the anxiety is free to move. It may get higher, it may get lower, it may move quickly, it may move slowly, but the point is it's free to move. It doesn't get amplified by all of these other emotions which make it kind of bigger and stickier and make it hang around for a lot longer. So there's no such thing as a life without anxiety. It shows up for all of us. But when anxiety shows up and the struggle switch is off, it's so much easier to live with than when the struggle switch is on.
Unhelpful thinking styles occurs when we interpret an event or situation that we believe to be true, when in reality it most likely isn't. By learning to correctly identify unhelpful thinking styles, a person can refute them. By repeatedly discrediting these patterns, they will diminish over time and be replaced by more balanced ways of thinking. Let's explore some of the most common ones. Mental filtering. the tendency to focus on negative events while neglecting the positives. Jumping to conclusions, the tendency to make irrational assumptions about people and circumstances. Personalization, the tendency to take the blame for absolutely everything that goes wrong in your life. Black and white thinking, the tendency to see things as all or nothing. Things are either good or bad, right or wrong, and there is no in between. Catastrophizing, the tendency to blow circumstances out of proportion by making problems larger than life. Overgeneralization, the tendency to make broad generalizations based upon a single event and minimal evidence. Labeling, the tendency to make global statements about yourself or others based upon situation-specific behavior. Shoulding or musting, the tendency to make unrealistic and unreasonable demands on yourself or others. Emotional reasoning, the tendency to interpret your experience based upon how you're feeling in the moment. Magnification and minimization, the tendency to magnify the positive attributes of another while minimizing your own. An anxiety-producing situation can lead to uncomfortable symptoms such as worry, fear, a racing heart, sweating, or a feeling of being overwhelmed. Uncomfortable symptoms are controlled by avoiding the anxiety-producing situation. Examples of avoidance include skipping class to avoid giving a presentation, using drugs or alcohol to numb feelings, procrastination on challenging tasks. Avoidance of the anxiety-producing situation gives an immediate sense of relief. The symptoms of anxiety lessen, but only temporarily. In long-term anxiety growth, the fear that initially led to avoidance worsens, and the brain learns that when the anxiety-producing situation is avoided, the symptoms of anxiety will be worse the next time, and avoidance is more likely. Anxious avoidant behaviors can be thought of as a cycle of negative reinforcement by rewarding self-limiting behaviors. Instead of learning new ways to adapt, you let the anxiety take control. Therefore, creating a repetitive cycle of avoidance and thus negatively reinforcing the feared situation and its associations. How can we overcome avoidance? When we avoid a difficult situation, we initially experience less anxiety. However, the more you avoid, the more anxious you may become about facing it in the future. Avoidance provides temporary relief but does not fix the problem. Learning to approach and cope with a situation is a lasting and powerful way of managing anxiety. Self-talk can help. Anxiety can be reduced by either decreasing your perception of danger or increasing your confidence in your ability to cope. Ask yourself, what are the facts? Will this matter a week from now? Remind yourself, I have dealt with anxiety before, I can do it again. I am a capable person. Negative interpretations of events are often automatic, resulting in feelings of anxiety. A thought diary does more than just capture a single event, emotion, or thought. It records how we handle multiple situations over time. Completing a thought diary can be a difficult exercise, yet it is incredibly worthwhile and provides a valuable starting point for capturing thoughts objectively, challenging them, and changing your negative thinking. Fill in your thought diary over the course of a week as difficult emotions arise. The fresher in your mind when captured, the more accurate the thought record will be. After recording unhelpful thoughts, it is essential to challenge and, where possible, replace them with something more worthwhile. When evaluating our thoughts, here are some steps to follow. Number 1, review your thought diary and choose an event that caused you distress. Number 2, consider the evidence for the most upsetting thought. Number 3, consider the evidence against your most upsetting thought. Number 4, what alternative thoughts might you have? Number 5, has your thinking changed? Be sure to perform the evaluation as soon after the event as possible. Recovery is a personal process that we go through in gaining control, meaning, and purpose in our lives. Recovery involves different things for different people. For most, recovery means living a full life while learning to live with ongoing symptoms. Everyone has their own goals in recovery. For example, recovery could mean feeling hopeful about your future, feeling confident that you can handle most things that do come up, reconnecting with your friends, returning to work or school. There are treatments for anxiety disorders, which include prescribed medication. 2 common forms of psychotherapy utilized for treatment of anxiety disorders are behavioral and cognitive behavioral therapy. CBT is the most widely used therapy for anxiety disorders. Research has shown it to be effective in the treatment of panic disorders, phobias, social anxiety disorder, and generalized anxiety disorder, among many other conditions. In behavioral therapy, the therapist will help the patient combat undesirable behaviors which often come hand in hand with anxiety. Here are some self-management tools that can be used to keep anxiety at bay. Mindfulness, self-care, sleep hygiene, aromatherapy, keeping a journal, breathing exercises, relaxation exercises, physical exercise. Relaxation training, which involves tensing and relaxing various muscle groups in an effort to help someone voluntarily relax. Exercise. Getting up and moving for 30 minutes a day can help mitigate some symptoms of anxiety. Self-help books based on CBT. Books using theories of cognitive behavioral therapy can help someone work through periods of heightened anxiety. Meditation. Learning to clear your mind through meditation can be a great tool to alleviate anxiety and stay present. The most important holistic treatment of all is self-compassion. Laugh. Be able to laugh at yourself and with others. This will increase endorphin levels and decrease stress hormones. Let go of frustrations. Do not judge yourself harshly or expect more from yourself than you would from others. Try to accept your faults. What is self-compassion? Mindfulness. Self-compassion involves recognizing when we're stressed or struggling without being judgmental or overreactive. Self-kindness. Being supportive and understanding towards ourselves when we're having a hard time rather than being harshly self-critical. Connectedness. Remembering that everyone makes mistakes and experiences difficulties at times. We are not alone. How can I incorporate self-compassion into my life? Self-kindness is demonstrating to yourself the kindness that you have towards others when you are struggling. Common humanity involves acknowledging that suffering is a part of life, and as humans, we all suffer. It's recognizing that if you are suffering, it is not because there is something wrong with you, but that inadequacies and imperfections are a part of shared human experience. Mindfulness is noticing when we are suffering and attending to our struggle. Being mindful is to observe negative thoughts with openness. A key piece to mindfulness is remaining non-judgmental when we notice our suffering and negative thoughts. The following video includes a simple breathing strategy that you can utilize to reground yourself if needed throughout the day.
Hey everyone, Corey Mascara here. People are always asking me for, what is a simple strategy that I can utilize throughout the day, in addition to my formal meditation practice, just to reground myself, recenter myself. And one thing I learned recently that I've found people seem to love is this strategy called Take 5, which you can do if you only have 30 seconds. So I just want to share it with you here. It's really simple. I say we do it together. Take out your left hand and just place it in front of you like this. And I want you to take your right pointer finger and place it right in the palm of your hand, right around your wrist. Now what we're going to do is slide the pointer finger up the thumb. And as we do, take an inhale through the nose and then slide back down with an exhale. Slide up the pointer finger, inhale, and then back down, exhale through the mouth. Slide up the middle finger, inhale, back down, exhale. Ring finger, inhale, back down, and then pinky finger, and back down. All right, so that's Take 5. If you were feeling really ambitious and you had a ton of time on your hands, you could do Take 10, and you do it on the other side as well. This is a simple strategy that you can utilize really at any point throughout the day when you first wake up, while you're at work, while you're in the bathroom, before you go to bed. It really doesn't take that much longer than 30 seconds. And there's something about the tactile nature of this, of sliding the finger up, feeling the sensations of the hand, and then syncing that with the breath, that really does seem to engage the parasympathetic nervous system and help settle us in. So, I learned this first in the context of kids, and then we started using it with adults. And then I was like, am I going to be bold enough to bring this into corporate settings and tell executives to pet their fingers every time they're stressed out? And I have, and even they seem to love it. So of all the things that I've been teaching, this has been one of the most popular things that people come back and say, like, all that other mindfulness stuff is good, but that Take 5 thing, really into that. So does it hold all the mysteries of mindfulness? No, but it is a mindfulness technique, and it is one way that we can ground ourselves back in the present moment when we find ourselves ruminating, lost in thought, caught up in the future and the past. You can do this. 30 seconds, reground yourself back in the present, and then start from there. So try it out, introduce it to your kids, introduce it to your friends. It's a very simple strategy that seems to be quite effective. All right, enjoy.
Some of the points we would like you to take away from this module are: consider if your worrying is useful. Analyze your worries. Embrace uncertainty. Be present and seek assistance. Lastly, be kind to yourself. We should strive to be caring towards ourselves as we are towards others. Should you find yourself feeling stress, Bounce Back is a free, guided self-help program that's effective in helping people aged 15 and up who are experiencing mild to moderate anxiety or depression. To learn more, visit bouncebackontario.ca. That wraps up Section 4 of the Healthy Minds for Life series. Thank you for watching, and thank you to our community partners. Be sure to tune into the 5th and final section where we focus on better understanding depression.